My name is Abby Foothouse, and this is a video initial consultation and health screening completed on the 15th of July 2021. Hi Mike, how you going?
Good, thanks. How are you?
Good, thank you. We're here today to do a couple of screening questions. So, have you done one of these before? It's to do with your child. What was your child's name?
Michael.
Michael, yep. Okay, so basically, before we can get started in an exercise program with him, we just need to go through some questions with yourself just to make sure that we, just in case we identify any challenges that he might have, whether that be, learning difficulties or vision or motor skills and those types of things, which might need to actually be assessed by a medical professional before we commence exercise. So that's basically what the purpose of this is today, and also just to find out some more information as to why your son wants to start training with us and what his goals are. Does that sound okay?
Sounds perfectly fine.
Perfect. Okay, so what was the first name of your child?
Michael.
So Michael, spelled like it sounds.
Spelt like it sounds.
Perfect. And his surname?
He's Markham. Mark Ham. All one word.
Perfect. And what was his age as of the 1st of January this year?
He was born on the 1st of August.
Perfect.
So he would be 10 because he was born in 2001.
Perfect, thank you. And he was a male. And your full name, Mark?
Actually, no, he'd be born in 2011 if he's 10, not 2001. I'd make him 20. It's 2011.
That's okay. You've forgotten how old your son is. So, Mark, I'm assuming your surname is Markham as well?
Correct. Mark Markham.
That is a surname. That is a name. And what was your address, Mark? Where Michael resides. So does he reside with you full time?
Yes.
Yep.
123 Fake Street.
Yeah, surname. Suburb.
Fancyland.
And are you here in Adelaide, obviously?
Yep.
Perfect. And your postcode?
5111.
Great. And what was the best mobile number to catch you on? I'm assuming Michael doesn't have.
Yep. 0412.
Yeah.
345. 678.
Great. And do you have a home phone?
No.
No. And what about a work number?
Just my mobile.
Perfect. This is just in case, we're training with Michael and we need to get in contact with you, obviously. Yep. And then has a GP or allied health professional been referred to your child?
No, he did have some issues with his knee about 6 months ago.
Okay.
He had OSD in his knee, but that's all sorted now. Okay. That was more through a physio than a GP.
Yeah. Okay. So, he doesn't have a general practitioner that he sees regularly, like a regular GP or anything like that? Okay. So if he did go to the GP, it would just be one of those walk-in clinic type things? Yep. Excellent. Okay. And then if there's an emergency, would it be best to contact yourself?
Yeah,
or
that's perfectly fine.
And then we just got to go through a bit of a checklist of some conditions that we sometimes see in people. So we just need to make sure that he hasn't got any of these things. Does your child or has your child ever had a heart condition?
Nope.
Great. Diabetes?
Nope.
Epilepsy?
Nope.
Breathing problems?
Nope.
That kind of would include asthma?
No.
No? Okay, great. Cystic fibrosis?
Nope.
Type 2 diabetes?
No.
Has he ever had a seizure or any had convulsions or anything? No. Talked about asthma. High blood pressure?
No.
No. High cholesterol?
No. Not at 10.
Yeah, you would hope not, wouldn't you? What about an eating disorder?
No.
No. Or any unexplained coughing or symptoms after exercise?
No.
No? Excellent. So he's quite healthy then.
Reasonably, yeah.
And he plays sport?
Correct. Plays footy.
Yep, great. So then, is your child taking any medications?
No.
No, great. And then in the last 6 months, has your child ever had joint or bone pain?
Yeah, so he had OSD 6
Yeah,
months
in
ago.
that knee, yeah. Do you know which knee it was?
It was his left knee.
Great. And is that fully
Yeah,
recovered
all
now?
sorted, no drums.
Does he wear a brace or anything?
Just tapes it.
Yeah.
That's more placebo than anything.
Okay. What about injured or broken any bones?
No.
Other than obviously the knee we've already talked about.
That's it.
And then muscular pain while exercising. Have you ever complained of any issues? Obviously outside the ordinary. Okay, great. So now just some more questions onto the second page. So does your child have any chronic disabilities or illnesses? No. What about any difficulty or problems with vision?
Nope, nothing.
No, or hearing or anything? Speech?
No.
No.
No, he's all good.
Motor skills, balance or sleep?
No.
Yeah? Okay. And if your child, is he allergic to anything like food, medications,
No.
like anything that we should be aware of?
Perfectly normal.
No. Does he follow a special diet, like a vegetarian or vegan or no? Has he had surgery in the previous 12 months?
No. Didn't have anything.
Yeah. And is there any reason, other than what we've already talked about so far, that your child should not participate in exercise?
No.
Okay, so some more on a lighter note. What's his favourite hobby? So you've talked about football.
Football.
That's obviously something he's interested in.
Cricket. Fishing. Tennis.
He's very active then.
Very active.
Yeah, likes being outside.
Correct. Doesn't like school.
Seems pretty common for 10-year-olds. Okay, so then we're going to take some measurements later. Obviously, when you came in today, you had your Michael had his height taken and his weight taken. Yeah. So with that information, I'll calculate his BMI, and then I'll return that to you when we catch up next week. He's planning to come in for his first session next week. Is that right?
Yeah, correct.
Yeah. So I'll make sure that that's all calculated. Probably later on today. And if there's any problems, I'll get back in touch with you. But otherwise, if you bring him in next week, we should be good to go based on the information that you've provided me today. Next week, we will also go through a bit of some testing to begin with, so some like pre-screening testing just to see where he's at, both aerobically, muscularly, and also in his flexibility as well. So all of that will happen in his first session next week. But basically, you've given me all the information that I probably really need today. Do you mind? There's an informed consent form here. This is just acknowledging that we've gone through this together, and that, to the best of your knowledge, everything that we've gone through today is correct. Yeah, and you're happy for him to participate in exercise going forward.
There you go.
Excellent. Thank you so much. And I really look forward to training with Michael.
No worries at all. Thank you very much.
Thank you.